Ainsley, and today I want to talk about my topic for our healthcare management project, and I chose medical devices. So why did I choose medical devices? I was really interested in this topic because of my recent diagnosis about 2 years ago as a type 1 diabetic. It came as a complete shock to me, and I was devastated for a while, and then I realized it could be worse. So luckily, my doctor recommended some great prescriptions, great medical devices, so I thought, why not talk a little bit more and find out some more for myself. I use a medical device as well now to properly manage my care. So I use a Dexcom constant glucose monitor, which hooks up to my phone, and it constantly tells me my blood glucose, blood sugar. So it's really convenient and really helpful, and I recently got an insulin pump, so I will be figuring out how to use that over Christmas break. And I really, like I said, I figured it would be interesting to see how medical devices are related to healthcare management and how they alter access, cost, and quality of care for individuals. So what is a medical device? The FDA states that a medical device is used for a multitude of reasons. They can treat, cure, prevent diseases and illnesses, and do so much more for the individual and their prognosis. It's really a relief to use them, honestly. I've inserted a picture of what I was talking about. I use a Dexcom, and that's what is included in the picture. So it has a cell phone. It has its own little monitor, but I don't use mine. You don't need to if you don't want to. It has a transmitter down at the bottom, and that is what attaches itself to a patch, which is inserted into my skin and connects to my phone that way. So that's how it reads the blood sugar, that's how it transmits the blood sugar, and that's how it gets on my phone. And it's really beneficial whenever I'm in class or at work or just anywhere where I don't want to publicly announce that I have type 1 by checking my blood sugar on a monitor. So it's really cool. Medical devices also vary in class types, which I will get into now. So first up, we have class 1. From the kind of breakdown of information that I found from Summit Data, they mentioned that this class requires the least amount of regulatory control from the patient. So really the least technical, the least expensive, the least really any prior knowledge that you need in order to use it. So this includes your tongue depressors, your like I pictured, the medical gauze, the medical tape used by professionals. So it's really just easily accessed things. Moreover, with type 2, class 2, these types must follow a little more FDA regulations. So they're set to ensure safety, and they require a little more regulatory control by the user when compared to class 1. So this is your heart rate monitor, as pictured in the example, your x-ray system, your insulin pumps, really things that are a little more up there in knowledge and price and all of that, and also require a little more usage compared to class 1. And finally, with class 3, the final class has the most regulation by the FDA. These are your life-sustaining devices. These are critical to live for some people, and they're also very high risk, high expense. This is your pacemaker, your coronary stent, your insulin pump with integrated constant glucose monitoring control. So actually it would be like my Dexcom connected to an insulin pump. So it's a little bit more up there in the technology included in the system, the expense that you're paying for it, and the regulation that the FDA sets for it, because there's more high risk to them and to the individual using. So, moreover, how do these medical devices and their many classes relate to management? So as we learned in our class this semester, healthcare costs, quality, and access can be significantly improved on a lot of things. I wanted to focus on how they can be improved based on medical device usage, especially when the device is being used properly by the patient. In regards to management, a few needs of the population must be planned prior to access being granted by supervisors and administration. So they need to focus on the needs of the country, the region and community, and the healthcare facility in order to be assessed and move on to figuring out how they can improve access, cost, and quality. The needs of the country should be looked into prior than any other area, as quality care at a cost that is effective for every patient in the population must be fixed in order to accommodate the patient's required needs. So that being said, our needs in America are different, obviously, than Europe. Europe has a universal healthcare system where basically they believe everyone has the right to care. In our system, we focus on you have a right to care if you can pay for it or if your insurance covers you, or basically they treat healthcare as just another item being sold in the market. So for some, that's beneficial because, sure, it does help a lot of things, but to others who are uninsured or can't afford the ridiculous cost of our healthcare system currently, this poses to be a problem. So management should filter that into consideration whenever they're looking into this. Next, management can look into regions and community needs that they serve. So regional needs, of course, vary like the countries do, but the said region being investigated may need more child-centered care, for example, if the population is dominated by young people starting to have children, whereas others may need more care focused on those with Medicare and Medicaid if they have a lot of baby boomers and those moving on to the elderly stages of their lives. Finally, the healthcare facility should be the main focus of the management team. As this is their community, they should want to serve in the best way possible, and this is also their means of employment, so their area of pride. These patients may also be people they know, people they should want to serve in the best way possible, just out of their kindness in their own hearts and their focus to helping people. So therefore, they must determine what those said individuals are wanting from their healthcare services. They should really know who they're serving. Hospitals have an extensive list of needs, depending on the extensity of the size of the facility. So even a small hospital has tons of needs, and I can't even imagine the needs of Barnes Jewish in St. Louis. That's where I go, and it's huge. It's like getting lost every time. So to name a few, however, patients may request longer provider availability hours. So this could be an example when if a community the hospital may serve has a lot of working class individuals, so they may flip around their hours and not be so available midday when people would be working, but focus on really early hours or later in the evening hours. It's not what's most desirable, but it may really help serve their facility, their patients, everything in their community to really become more healthful. More supplies may need to be shipped as well, so like how we were talking about depressors and medical gauze, maybe a community is really going through theirs because they're just doing a lot of regulatory checkups, regulatory policies. They're really keeping up with their individuals and really doing a great checkup. And maybe individuals may even want an off-site, more conveniently located clinic to those farther from the main site. So like how we're going to get into it next, that means our rural individuals. Once needs are understood, though, access can be granted and achieved. Consumers demand an ease of access, how we learned also in this course, so it's critical to healthcare as we know it. With universal access to information through our society's constant swap of media and internet services, today's healthcare consumer is demanding more options and taking control in determining the course of healthcare. This bounty of information leads many to consider pharmaceuticals and medical devices on their own time and turn to their doctor for further assistance in getting the device, or even getting more information. So I know I'm a prime example of that, considering I constantly was worried about my future health, my organ survival, basically, because I'm not the best diabetic. I'm terrible at routines with it right now, and I really was worried about my future. So I was researching the pumps, but I didn't like how they were so blatantly obvious on the outside of your clothes with cords everywhere. And the moment I researched the Omnipod, the new technology that is kind of like my Dexcom, where it has a patch and it goes into your body through a little sensor needle, I was like, wow, that is already what I use. I want something like that because that would be much more beneficial than the pens and needles I use now to administer insulin. So that is kind of how I got the research jogging and really started getting it going with my doctor, and he was able to help me get the Omnipod. So moreover, in order to improve locational access to medical devices and provider care without increasing provider hours by too much, Supervisors and managers can use technology such as email and text messaging to communicate with patients quickly in order to clarify care plans, answer medical questions that they may have, or set up future appointments. This is not for emergencies, obviously, but this is a good way to kind of just avoid making an appointment for something so small as, when can I see you next? Or can you help me with this quick question I have about my care? It shouldn't, again, be for something that's a really large a situation that should be seen for a provider, but it is really a great way to talk quickly. They can also consistently see patients and become extremely familiar with their history in order to ensure proper medical device use and management of their illness or disease. This method also further solidifies the patient-provider bond of trust and confidence, known to us as the fiduciary relationship between patient and provider. And it's much better than just a random physician a patient must now share private information with. So it really eliminates a patient feeling uncomfortable. It solidifies their bond by talking about things that this doctor is familiar with about you, and it just makes you more confident in managing your care. Finally, the team can manage patient demand to improve access to care. They should make sure patients' needs in relation to their device or disease are met and answered at the time of their appointment. This helps to make sure that future appointments are not booked with a patient and eliminates that need when the initial question could have been answered in the initial meeting, so that other patients who are actually in need of something a doctor could do for them, and seeing a doctor could help them out with significantly, they're not denied that access due to someone else taking up their time that could have been answered way faster. So, kind of how I touched on earlier, rural residents are a lacking area in terms of access. So, configuring rural patients to both a capable provider and an effective device plan can be extremely difficult, especially if they live far away. To take a whole day out of their time to meet with a doctor, many would not see the benefits to that, and I know I would not. It may be equally as difficult for a provider to take the risk that the rural patient may be late to the office due to traffic that they didn't account for, or not allowing enough time for the drive, further messing up his or her patient schedule. So this would really not only mess up the provider's schedule of seeing the patients that he has allotted for the day, trying to get you in when you missed your appointment from being so far, and then really trying to assist all the other patients that also took time out of their day to wait in the doctor's office. So it's a whole melting pot of mess if someone misses their appointment due to being far away. And luckily in today's times, though, we have telehealth, a new technology that allows providers to communicate effectively with their patients through cell phones or computers, kind of how I was discussing earlier, but this is an actual system and new technology that doctors have been implementing in certain areas. In the example to the right that I included in the photo, a doctor is meeting with his patient through a video chat capable system. This also delivers patients the care they need at the comfort of their own home. So patients can really ask anything that is not emergent, that a doctor could answer quick on the spot, and it allows them to be face-to-face even though they're through a computer screen. And kind of how I was touching on, benefits to telehealth increase. It increases access to provider time, especially for those that live really far away from a main office or facility. It can help capture, store, and use patient info to improve medical outcomes and decisions. And ultimately, telehealth can reduce costs by decreasing the likelihood of readmission, improving utilization of employees, and using preventative measures. So, and I know I kind of mentioned this in the other slides, like I said, but it just really helps everyone in this kind of situation because of how it assists patients and providers and the whole system as a whole to keep that flow going. So to further show how this helps, telehealth is with the red 6%, and it just highlights perfectly that telehealth can be a great resource to people not really knowing how to get those rural residents in, or those people that don't really try and come into the office as much, especially for those that are far, like I was saying. And the practice greatly reduces the need for readmission or revisiting with a patient, and especially prevents the route too many individuals take, as we know, to the emergency room. So the emergency department is the light blue with the 20%, and this just highlights how many individuals fall for the emergency room just for, mostly it's a simple question. I learned that in healthcare in the US last year, where people will go to the emergency room for something as small as a question that they wanted to ask their provider the last appointment but didn't know how. So doctors, to prevent this, should really just focus on implementing telehealth, or making sure that they can talk with their patients by using the teach back method, and that the patient truly understands what is being said in the meeting. Moreover, mobile devices can also be extremely helpful. They're not just for the rural population. Everyone these days has a mobile phone, and with new cellular devices coming out monthly, it's especially helpful that they can now have health benefits as well. So with the amazing technology provided to us, cell phones can benefit our health greatly and manage diseases without needing to see providers face to face. So as mentioned by C. Lee Ventola, mobile devices and applications provide many benefits for healthcare professionals, perhaps by most significantly increasing access to point-of-care tools, which has been shown to support better clinical decision-making and improved patient outcomes. So ultimately, it improves the patient's health, and it improves doctors in making the decisions because they can see what's occurring on their mobile device through data sharing systems. Mobile device sharing especially helps with chronic disease care. I'm, again, another good example because I share my information through the Dexcom app. My doctor has the same app and can constantly see and update me by just a phone call away of when I should lower or raise my insulin intake due to my current blood sugars. So why use apps for health? It may seem a little silly or a little too impersonal, but phones and apps aid providers in assisting patients with many tasks, such as information gathering, communicating, patient monitoring, and medical training and education. So there are so many diabetes helper apps in my app store that I've been able to search, and my doctor, like I was mentioning, can see my blood sugar data through the monitoring app he has. These apps free up a lot of provider time and allow them to assist others with more prevalent needs, all while allowing the patient to be guided in managing their disease or illness. It also lets them efficiently control the app user's data and correct and assist them as usage continues. For example, my doctor can call me, how I was saying earlier, whenever he sees my blood sugar was high for a prolonged period of time, and can alter my insulin ratio solely based on the shared information I was given him. The mobile apps method really benefits both patient and provider, basically, was what I want to say, and excess appointments are no longer necessary, so we can avoid that as a whole just by implementing mobile apps alone and some telehealth. So, once access is granted, the management team has to be ready to provide the best quality of care to their patients and patient families. The best quality of care can be granted to patients by the use of effective policies by employees, such as confidentiality and universal precautions. So that is hand washing, doing proper checkups, doing great pass-offs with whoever is next in line to see the patient, those sorts of things. Maintaining devices and understanding the product to be knowledgeable on recommendations to patients. Managing inventory of devices to avoid stock issues, such as recommending an item that they do not have in their hospital, or even the device company has no longer in stock, which is very rare. Implementing the product to patients based on needs, insurance plans, and current diagnosis. Guaranteeing safety of the product to patients in order to avoid lawsuits, and keeping the patient first and foremost, which is the most important. And measuring clinical effectiveness and successfulness once in use by patient to make sure treatment is working and being managed by the patient. So that one is very crucial as well. It should always be the patient's responsibility and the provider's responsibility to ensure that the patient is using the device properly. If they're not, it's a big waste of money, a big waste of their time, and it can ultimately really badly affect their health. For an example of this, 7 major diseases account for a majority of the deaths in the United States, including heart disease, cancer, diabetes, arthritis, chronic bronchitis, influenza, and asthma. For many of these health conditions, early systematic intervention can be highly beneficial, and a medical device may be able to greatly assist. But what about the cost? The cost is always the main question in people's minds. Bottom line, medical devices can be extremely expensive. You can't lie about that, especially when a patient is uninsured, how we were talking about earlier, when uninsured individuals are often extremely forgotten about in our system, and it's very sad. And it's really hard to get them the care that they need when they don't have the means to buy the care. But it's really hard to ask someone to pay for care out of pocket. With effective management and coordination of teamwork between medical sales employees and healthcare providers, a plan can be devised to help the patient obtain the medical device in the most cost-benefiting way to both patient and healthcare facility, however. Once the patient is trained on the device, it is crucial that they understand how to use it in order to avoid costs actually increasing. So that was kind of what I was touching on. Costs can increase for patients, and that upkeep of a device could incur quicker than when actually being used the correct way. So sure, the initial cost may be extremely expensive, but if you're not using it right, it's going to keep going up. You're going to have to keep buying supplies quicker. You may have to keep managing yourself more, so that takes out more time for you and is that more hidden cost of time management. It can also go up for the provider and facility in that they are sustaining this individual's improper care by consistently seeing to their issues with increased appointments and device education time, when this could have all been avoided, bottom line, when the patient correctly knows how to manage themselves. Without proper device use and management by the patient, it will be very hard for providers to control the cost of the device and the harm being done to the patient's health. So really, the patient is being put at a great risk when they don't manage themselves, they don't care about their health, they don't see how the device is really helping them. All of these can be reasons why harm is being done and how death could be in the near future if you're looking at it that way. This graph, though, however, I know it's a little fuzzy, but the information on it is perfect. I retrieved it from the Frontline of Healthcare report, and it outlines just how important proper procedures and equipment used by doctors are to ensure quality is met and costs can be reduced. So the main point on this table that I wanted to make is the use of electronic medical records. These systems collect patient data and keep it updated, which is then stored in the system and can be shared with even more facilities and systems. It is amazing technology that we use today, honestly, and we can only get better from here. Further, standard treatment protocols are also the next most highly used today on the chart by providers and have benefited quality and costs even more so. If general procedures are followed by professionals when treating any patient, not just those with multiple needs or those that are device users, costs and quality can be significantly improved by the facility, by the provider, and for the patient. So that brings me to overuse, misuse, and underuse. These are all issues in our system, and they kind of go under the radar, or at least they did for me. I didn't even know that medical devices had these problems, but let's start with overuse. So overuse can include giving out an abundant amount of devices to those that don't really need or have the physical or mental capacity to use them. According to Schleifler and Rothman, overuse in the United States occurs due to fee-for-service payment structures, physicians' fear of malpractice lawsuits, industry marketing of pharmaceuticals and devices to medical professions, and physicians' culture of thoroughness. So doctors love to be thorough. They love to ensure that they are covering themselves in a case of lawsuit. They have been able to offer everything that they could have to the patient, no matter how expensive or how much the patient may not really need it, but they recommend it anyways. So this is an example of overuse for that reason. Next, with misuse, as mentioned earlier, inadequate maintenance plans can lead to patient misuse. When patients are not managing their devices properly in an effective manner, misuse problems arise and lead to bigger issues such as increasing costs and patient health decline. As stated by Cope, Nelson, and Peterson, organizational factors that can also lead to the misuse of technology include policies, resources, culture, social norms, management commitment, training programs, and employee empowerment. So if an employee is empowering another employee to offer someone a device, or if they are not following policies correctly, if the culture, they think that the device shouldn't be used a certain way. Those are all examples of how someone can be led to misuse their device. Um, this is especially differentiate. This can especially differentiate depending on the work environment setting and people in said environment involved. Finally, with underuse, preventing a deserving, competent patient from a medical device due to assumptions such as their insurance not covering it or they will not be interested in the technology offered is an example of underuse. Also, a patient who is misinformed and denies a medical device due to poor communication or training from their care provider is another reason why devices are not being used to their full treatment potential. Furthermore, low-volume hospital centers may not have the means to perform the practice due to minimums not being met, therefore obstructing patients from getting the training and device necessary to their needs. So ultimately, a hospital just may not be able to afford it, and therefore they don't recommend the product, or they can't sustain the individual, so they don't try to further their care and make it more expensive. So, which leads me to my next point. How do these errors exactly affect the United States? As mentioned by as Adrienne Berman, she states that death and cost increases in the United States and anywhere really due to poor reporting, differences in definitions of what constitutes a medication or device error, lack of awareness of reporting techniques, lack of time, which is a big one, fear of litigation, inability to determine causality, and reluctance to admit error. The total costs associated with medication errors, such as healthcare costs, lost productivity, disability, and loss of household income, to name a few, in the United States may be even as high as $50 billion a year. That number is shell-shocking. If the overall focus is switched from covering the cost to being proactive and preventing errors from occurring in the first place, the increasing rates of costs, morbidities, and mortalities can also be significantly improved, which is a big benefit in my eyes. So how can we fix these errors in our system? As mentioned by McNeil in Hidden Barriers, in order to treat the overuse, misuse, and underuse of medical technologies, error must be recognized and reduced to ensure success. The first issue facing providers and management is the uncertainty they face in making decisions on a case-by-case basis. As touched on earlier, doctors are always uneasy when it comes to decisions they have to make on cases that they may have an undesired outcome, such as a risk of dying. However, they are the professional, and their patient needs their help in an attempt to get better and manage their care better. So if the doctor realizes this, the use issues in regards to devices and care in general can decline. And ultimately, that patient fiduciary bond with their provider, they have the confidence already, so they should trust that their doctor has their best intent in mind. Secondly, the rise in costs brought about by said use problems are an issue. This specifically targets underuse of technology, as both rising costs and efforts to contain the cost can promote the underuse of new, particularly expensive but effective, even cost-effective medical technology. So in short, this amazing technology that is out on the market today is being avoided for fear that it would increase costs, when in turn it could actually make healthcare more effective and less expensive. So, in conclusion, this topic has been a lot of fun to learn about. I'm a current medical device user, but I've never thought about how this can affect my future profession, how the doctors and facilities I utilize now and frequently meet with, it affects them as well. So chronic diseases are the reason for massive expenses and shortness of life in millions of people. However, medical devices can be a true blessing, both to the patient and provider prescribing them. They truly have the power and save lives and can further grant access, improve quality of life and care, and decrease healthcare costs if patients use them correctly. Thank you for your time. My reference pages are on the following pages. Thank you again.